On today's podcast, we're going to be talking all about celebrities and plastic surgery in the news today. So I have plucked out a number of different articles that were recently written about celebrities and plastic surgery, and we're going to break it all down. It's going to be a lot of fun. We're going to start out with one of my favorite celebrities in the media, one of, I think, all of our favorite celebrities. She is Dolly Parton. And Dolly has been very open that she's had plastic surgery before. Let's see what she has recently talked about in the media. Okay, this is from yahoo.com, the lifestyle part. While some stars choose to remain tight-lipped about cosmetic procedures they've undergone to stay Hollywood ready, Dolly Parton is, as always, upfront and honest about the work that goes into maintaining her iconic appearance. The Jolene singer, age 77, can you believe she's 77 already? Candidly opened up about her experience with Botox, fillers, and more in an interview. If something is bagging, sagging, or dragging, I'll suck it, pluck it, or tuck it, she quipped. In another recent interview on the Howard Stern show, she told the host that she specifically dabbles in fillers, Botox, and Juvederm, but she treads lightly. I try to do just little bits at a time. I don't really like big stuff. She added that getting any type of work done always makes her a little nervous, but she has the best doctors for the procedures. You've just got to be very careful not to overdo it because you never know. Anytime you go under the knife, you could come out looking not good, she told Stern. So actually, interestingly enough, Dolly's plastic surgeon is a guy in Denver, Colorado, a guy named John Grossman, Dr. John Grossman. And I actually, when I finished my residency in plastic surgery, I applied to different fellowships around the country. Fellowships are where plastic surgeons who finish their training can go and do additional training in their specialty. And for me, I was looking for additional cosmetic surgery training. And so I actually applied to Dr. Grossman's fellowship. I ended up going to LA instead, worked with Dr. Richard Ellenbogen, who's a big plastic surgeon out there. And honestly, I never got a reply from Dr. Grossman. So had he replied, who knows, maybe I would have operated on Dolly back then. All right, so the article continues that Parton has, however, experienced mild complications with some injections. Every now and then you get a hematoma, she said, which is a kind of bruise that results from a large collection of blood. Or sometimes with fillers and Botox, you can get too much and have to wait till the swelling goes down to look normal again, Parton continued. It means that instead of being back at work in 2 weeks, it's a month. So yeah, that's something that can happen. You get injections, a filler or Botox, you can get a hematoma. Hematoma basically is just a small blood collection that you can get in the area that it was injected. And the key with a good injector is if you see that, you know a hematoma is coming. Because once you put the needle in and you take it out, if blood starts to come out of that little needle hole, then the practitioner needs to put pressure on it right away. Otherwise, that hematoma can get bigger and bigger. And I've heard stories of doctors who've done the injections and immediately left the room, and then a hematoma starts brewing, and the patient gets a huge black eye from it because of lack of pressure. Whenever I do it and we get a potential hematoma, that's what I do. Right away, put pressure on it for a minute or two. That usually will stop any hematoma from developing. You may get a little hematoma, but not this big honking thing that you can get. So really, I think that Dolly Parton, I think she is just a breath of fresh air out in Hollywood. You know, she's been very open that she's had implant surgery done many times. My guess is she's had at least 2, if not 3 or more facelifts. I think really with Dolly, it's not what has Dolly had done, it's what hasn't Dolly had done. And I actually made a video on my main YouTube channel dissecting down Dolly Parton's plastic surgery. It is a lot. But you know what? It works for her, and so all the more power to her. She does so much good in the world with all the charities and everything that she does that I admire her, and I think that she is definitely a national treasure. All right, well, speaking of national treasure, the next article I have here, speaking of national treasure, is on Donald Trump. And so I'm not going to get at all political with this podcast, but let me read this article. The former president hosted a New Year's Eve function at his expansive Mar-a-Lago resort in Florida, where he was snapped in a photo by a guest at the party. This is from Newsweek magazine. Ron Filipkowski, a former federal prosecutor and frequent Trump critic, reshared the photo to his X, formerly Twitter account, and poked fun at the Apprentice star's appearance. So he had a party at Mar-a-Lago, and this guy, Ron Filipkowski, was at the party, but he was a frequent critic of Trump. So why would he even be invited to this party? That's beyond me. So Filipkowski captioned the post, Trump last night with Dominica, ambassador to the UN, ear looks weird. So the thing is, there was this photo then of former President Trump, which had basically what looked like a scar in front of the tragus, which is the cartilage of the ear. And I did look at this photo, and I tell you, the photo does look like the scar from a facelift. Now, I haven't looked really closely at photos of the former President Trump, but we know looking at photos of President Biden that Biden's totally had at least one facelift, maybe more than that. Has Trump had a facelift? If he has, I think it's been a long time. That part of the ear did look like it could potentially resemble flattening of that portion of the ear from a possible faceless scar, but the photo was not really in great definition. It was hard to really see. So based off that photo, yes, it did look like a faceless scar, but it could just be the lighting and all of that. I would say I am like 99% certain that Joe Biden has had a facelift. Trump, I haven't looked at that closely. So, and if he has, you know what? All the more power to him. That's fine. A lot of people have had facelifts. And like I said, I think if he's had one, it's probably been quite a while. Okay, so the next article I have here is on Sharon Osbourne. Speaking of having had multiple facelifts, Sharon Osbourne, this is from The Mirror. Sharon Osbourne shares why she's staying away from plastic surgery after a botched facelift. There is nothing worse than a botched facelift. Sharon Osbourne has revealed why she's staying away from plastic surgery after undergoing a botched facelift. The reality star, 71, has recently undergone a dramatic weight loss journey, with her also recently opening up about the cosmetic procedures that she has undergone. Sharon has lost a whopping 42 pounds after using Ozempic, a diabetes drug that is known to help with weight loss. I swear to God, everybody in Hollywood is on Ozempic. It's crazy. Speaking to Best Magazine, Sharon spilled, I had a facelift 3.5 years ago, and it was the worst because the guy messed up. I was left with one eye higher than the other. It took a year to put it right. I frightened myself with what happened. I won't do any more. There's nothing left to stretch, pull, or cut. The article goes on to say that this comes shortly after Sharon opened up to Mail Online, where she admitted, I'm too gaunt and I can't put any weight on. I want to because I feel I'm too skinny. I'm under 100 pounds and I don't want to be. Sharon previously revealed that she started on Ozempic last December. Speaking about it at the time, she said, I started on Ozempic last December and I've been off it for a while now, but my warning is don't give it to teenagers. It's just too easy. You can lose so much weight and it's easy to become addicted to that, which is very dangerous. I couldn't stop losing weight and now I've lost 42 pounds. I can't afford to lose anymore. So a couple of things to unpack from this interesting article about Sharon Osbourne is that she had a facelift gone bad, but then she says that her eyes were uneven. Now, a facelift basically is a lower face and upper neck lift. The term facelift really describes treatment of the lower face and the upper neck. And so if you've got jowls, if you've got loose skin hanging from your neck, then that's what this surgery does. And at the expense, though, of permanent scars both in front of and behind the ears. And so that's why I mentioned with Donald Trump how the scar, it looked like he may have a scar in front of the ear, which is really a major sign of a facelift. And interestingly enough, we're not talking about Madonna in this podcast, but Madonna, if you look at photos of her, and I actually went through Instagram because I made a video of her about her on YouTube, and you can see her hair always is covering the front of her ears, like always. You will never see a photo, or at least a recent photo of Madonna, where you can see her entire her sideburn and the area of her front of her ears, because my assumption is she's got scars there that she wants to cover. And so Sharon's had these surgeries, and she said that her eyes are uneven. So I wonder if instead of she's saying that she had a facelift, maybe she had a brow lift done, in which case that can cause your eyelids to look uneven, or maybe she had a facelift combined with eyelid surgery doing that. But technically, a facelift will not change how your eyes look. It really just changes the lower face and the neck. It can change your mouth. There are some people you may have seen in Hollywood where they had a ton of facelifts and their mouths look like they're actually too wide because they've been pulled so many times. I firmly believe, and I do a lot of facelift operations, I firmly believe that people can do upwards of 2 facelifts, maybe 3 at the most, before you start really not looking right. And really, I would kind of put that at 2 facelifts. There are some people who now are advocating, some doctors who are advocating for people to get facelifts done when they are really young, like when they're in their 30s and early 40s. And one of my main issues with that is that as you get older, that when you actually need a facelift, is it going to be too late? Are you going to have too much scar tissue? Is it not going to look right? And so in those situations, really, I think that yeah, I mean, some people say doing it earlier is better. I don't think that that's necessarily the case. In general, I wouldn't recommend a facelift unless you just have really advanced aging that's genetic in your 40s. I wouldn't recommend in general until you hit at least 50. And so the other part of this story is her Ozempic. So Ozempic basically is a medication that's used, FDA approved for diabetes, because it helps to lower blood sugar and it impacts the secretion of insulin. But at the same time, it also slows gastric emptying. And so it slows down how fast your stomach will empty food. And because it slows it down, the food can sit in the stomach longer and you feel full longer. And so people lose weight. Now, this medication I think is so important for people who have diabetes to help control their blood sugars, because diabetes is a really difficult disease and can have a lot of just horrible complications from it. But when people are kind of willy-nilly using this for just weight loss, especially in somebody who isn't that heavy and they just are wanting to take it because they want to lose 10 pounds or something like that, is there a long-term potential metabolic complication that you can get from this? Could this really mess up your metabolism? And this is something that my good friend JJ Virgin has mentioned before. As a plastic surgeon, not a weight loss expert, this is not something that I have followed myself very closely, but definitely is a concern, is how do these medications alter your metabolic rate? And is it going to become an issue where if you go off of these medications, either like in her situation where she can't put weight on, or is it the opposite where you gain a lot more weight than you would otherwise be? And now you are literally hitched to this medication to try to control your weight. So more and more information is going to come out with this. There are so many other people, I think, who are more knowledgeable about Ozempic than me, not being a weight loss doctor specifically. But I think it's really, really interesting. And I have seen recent photos of Sharon. And yeah, to me, she looks so skinny that to me, it looks unhealthy. As you get older, it's actually good to have a little bit of extra weight on you, because if you get sick, that little added weight can, create energy for your body that's needed if you're real sick and you can't eat and stuff like that. That can actually be a beneficial thing. You don't want to be rail thin as you get older. Okay, so speaking about weight loss, drugs. The next article is on Boy George. Boy George, if you are a millennial or a Gen Z and you're listening to this podcast, you're like, who's that? Well, Boy George was huge back in the 80s. I was never a huge fan of his band Culture Club, but a lot of my friends were really into Boy George. And so he had a couple of big, big hits. This article is from OK Magazine and says, Boy George admits to undergoing painful tummy tuck and taking new weight loss medication in new memoir. Boy George is coming clean. In his new autobiography, Karma, the singer detailed his trouble with losing weight and admitted he's taking Ozempic-like drug, Mounjaro. I have struggled with my weight most of my life, and being under public and media scrutiny doesn't help, the star wrote. We are all guilty of saying, hasn't so-and-so got big, even when we are carrying extra pounds ourselves. I'm on Mounjaro, isn't everyone? Well, I don't think everyone. I'm not on Mounjaro. Trust me, anyone who was fat last year and is now skinny is on the wonder drug, he quipped. The Grammy winner, 62, also revealed that he improved his appearance via a strict diet and a tummy tuck, the latter of which he called the most painful thing I've ever done, because I went on tour straight after with Cyndi Lauper with a blood bag attached. Oh my gosh. I previously lost 7 stone, which is 98 pounds, doing the metabolic balanced diet, and I need to get rid of the excess skin, he explained in the book. When anyone asks about my scar, I say I had twins by cesarean. That's funny. I've never had Botox, though, and I might be the only person in show business with my own face. I'm not frightened of getting old, and I think I've grown into myself, he insisted. It might seem weird to say I feel sexier, but I actually do. The crooner had 3 hair transplants over the years as well. So Boy George is on Mounjaro. Boy George is not on Ozempic. And what is the difference? Well, Ozempic and Mounjaro are both FDA approved for diabetes patients. But Ozempic, the main drug of Ozempic is semaglutide, is also FDA approved for weight loss as well. Technically, it's not Ozempic. It goes by a different name. Mounjaro is a different medication that's only FDA approved for diabetes. But when you look at studies show that people who take Mounjaro actually lose weight faster than people who take Ozempic. It's not FDA approved for that use. Now, if a medication is not FDA approved for the use you want to use it for, or as a doctor you want to prescribe it for, but as a physician you deem it safe to be used for a different purpose, you can then prescribe it off-label, meaning that you as a physician believe that medication is still good for that patient for a treatment other than what it's FDA approved for. Using something off-label is not uncommon at all. For years we've used Botox off-label. So for years Botox was only approved for wrinkles of the glabella, which are the frown lines. But it was used all the time for wrinkles of the forehead and of the crow's feet. I used it all the time off-label. Botox I use a lot of time off-label for injection into the masseter muscle, the muscle of the jawline, to help to reduce the thickness of it. And so using something off-label is not something that is bad or it's frowned upon. It's very, very common. Mounjaro is just a medication that hasn't been used that I've heard from celebrities. Ozempic is kind of like the Botox of these medications. Mounjaro is like the Dysport. People may be on it, they may be taking it, but they're like, oh, I just on Ozempic, even if they're technically on Mounjaro. And so that's kind of what this whole Mounjaro is. Ozempic has become like the Kleenex, the Botox, like the brand name, even though people may be using something technically different. They just say they're having Ozempic, okay? And so it looks like Boy George has been on Mounjaro, which once again, very common. And then he had a tummy tuck after losing a ton of weight, which I've done that on many men who have lost significant amounts of weight. You do a tummy tuck, you remove the excess skin hanging from the tummy, you leave them with a hip-to-hip scar and a scar around the belly button. Now, the painful part of a tummy tuck, believe it or not, is not that hip-to-hip scar. It's not cutting out all that excess skin. It's the muscle tightening that we often do with this operation. So especially in women who've had multiple children, the muscles of the tummy can get separated. We call that a diastasis, where the rectus muscles, the kind of paired muscles that come straight down the tummy, they have tendinous inscriptions that can give you a six-pack. Those muscles can get separated after multiple pregnancies and sometimes not really just come back. That separation is called a diastasis, and then we can use sutures to basically put that separation back together. Suturing those muscles together, that's the most painful part of a tummy tuck by far. And I tell patients it's like 70% of the pain of a tummy tuck is that muscle tightening. Now, if you have somebody who hasn't had children, but maybe they were larger, sometimes we can bypass the muscle tightening because everything was maybe bigger with them, but not necessarily their tummy sticking out so far. So in those cases, it really is case by case. And somebody who has a tummy tuck for weight loss, whether we tighten the muscles or not, it really just comes down to the condition of those muscles. Now, if Boy George did not have his muscles tightened and he's all complaining about the skin that was removed and the pain from that, that is nothing compared to if he actually had muscle tightening, how bad that would be. So we'll give Boy George the benefit of a doubt that it was real painful because he had the muscle tightening. Otherwise, there are a lot of women who've had tummy tucks who would tell him to stop complaining because it could be a lot worse. And you know what, Boy George, good for him. He had a tummy tuck. He's had some hair transplants, very, very common hair transplants in men, and some in women too. The key that you have to remember with hair transplants is that they're only needed when you want to reestablish, let's say, a hairline, or if you have an area that's just bald. If you've got an area that's thinning, there are a lot of non-invasive options that you can do that can help thicken that hair. You don't necessarily have to have a hair transplant. And I have covered that on a previous podcast before, I think it was maybe about a month ago, where I gave my recommendations of what I did for my hair thinning journey. I don't have hair loss in that I don't have areas that are bald, but I've had areas that are thinning that I have used non-invasive natural options to try to improve. Okay, we have got one celebrity left, and that is Blac Chyna. Blac Chyna, this is from eNews, eonline.com news. Blac Chyna reduces her breast size in latest plastic surgery reversal procedure. Blac Chyna is sharing more about her journey. After undergoing breast reduction surgery in the spring of 2023, The former reality star, also known as Angela White, offered more information about where she is in the process as she again decreased her breast size. "Yep, I did it again," Blac Chyna said in a video posted to Instagram December 31st. "Quick story time about the breasts. So earlier this year, I was like, you know what? I want to take out my boobs. I'm kind of over it. I'm tired of the fake look. They're too big for my body, too big for my frame, and it just doesn't fit me as a person anymore." So she went to the doctor. "My doctor suggested that I go smaller and then smaller just to see how my skin retracts," the model continued. "Because if I don't do it that way, then I'll just be left with basically saggy skin, and I wouldn't like it because it would look really deformed." Blac Chyna said she decided to reduce her implant size from 585 cc's to 385 cc's. However, she noted that the worst thing that could possibly happen happened. So what's the worst thing that can happen if you have breast surgery? You could die. That would be the worst thing. So good thing the worst thing that could happen did not happen. Something else happened that probably wasn't good. Blac Chyna, thank God that the worst thing didn't happen to Blac Chyna. I mean, of course, we don't want that to happen. Blac Chyna explained that she underwent her latest surgery on December 21st. "We decided to go with 190 cc's, she shared. "My doctor told me that I needed some type of implant because if I don't do some kind of implant, basically my boobs are just going to be mush." Mush! That's a pretty strong statement. Mush boobs. Nobody wants mush boobs. "All in all, though, I'm very, very, very happy." That's 3 very, so she is very happy. The entrepreneur continued. "And I'm excited because now I'm a part of the Itty Bitty ITTY committee. The past year has been one of transformation for Blac Chyna, not only physically, with her also undergoing a butt reduction, having her facial fillers dissolved and removing a tattoo, but also personally as she got her doctorate from the Sacramento Theological Seminary and Bible College. Good for her. That's awesome. Celebrated more than a year of sobriety. That's great. And entered a new romance with Derek Milano. Look at Blac Chyna. She's impressive. "I'm just really excited for 2024, she said in the video. Like 2023 really showed me a lot about myself, and you guys were right there and supporting me, and I just can't thank you all enough." Such a nice article about Blac Chyna. She's got a doctorate. She's celebrated a year of sobriety. She had her implants reduced. So let's talk a little bit about this implant reduction thing. So she went from 585 cc's. That is a big implant. Implants, the average size implant that I use goes anywhere from about 300 to 400 cc's. So in general, I believe anything less than about 300 cc's is a small implant. Anything bigger than 400 is considered more of a bigger implant. And 585 cc's is definitely a big implant. So she went from 585 cc's down to 585, she said. Yeah, 585 down to 385, which once again, now you're getting into kind of that mid-range implant size. And the reason why her doctor did not want to go from 585 to her final number, which was 190, is because that's such a huge difference that you're going to have loose skin. And so the idea is that by kind of going stepwise down, you can allow that skin to slowly retract, gradually retract. And before you kind of, make that final change, you have a better idea of what you're getting, and you don't end up with these real deflated breasts if you don't want them. And sometimes I do a similar type of a thing as well. But the problem, and this is what she had, was a capsular contracture, is every time you switch out a breast implant, your body can react differently to the new implant as it did the old implant. And so just because her body, let's say, created very thin scar tissue around her first set of implants, doesn't mean it's going to do that with the second set. And unfortunately, in her situation, her body overreacted to one of those new implants and created scar tissue around it. And that can cause the implant to look and feel hard, firm, and even painful. The most common complication from breast implants is capsular contracture. Now, BII, different story. There may be a higher percentage BII. We don't know what percentage of people get BII. But in general, when you're talking about a physical complication from an implant, capsular contracture is the number one most common thing. And it's the reason why you may see some celebrities in Hollywood that look like they have these round, hard balls on their chest. That sometimes is due to a capsular contracture. And so it sounds like her surgeon then removed that capsular contracture, basically removing that scar tissue, and put in the 190 cc's, which is where she's at now. Now, sometimes when you reduce the implant size that much, if the skin does not retract enough, you may have to do a lift, which essentially is cutting out the excess skin. The problem with a lift, and why a lot of people don't want it is because it can create a lot of scars. And those scars typically extend circularly around the areola, vertically down, and horizontally underneath the breast. That is a lot of scars, especially on somebody really young, who may scar thick and all of that too. So it doesn't sound like she had a lift, which is great. And that hopefully she's happy with her smaller implants and kind of that gradual stepwise down. So did you enjoy this kind of roundup of celebrity plastic surgery? If you did, please leave me a comment